Greetings from Las Vegas for CareTalk's third annual HLTH conference interview series. Our guest today is Ben Leonard, health technology reporter at Politico, where he covers digital health happenings in the federal government and the industry overall. Welcome to CareTalk, America's home for incisive debate about healthcare, business, and policy, and now a top 5 healthcare podcast. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the president of Walgreens Health. So Ben, welcome. What is health technology?
Wow, that's a pretty big question. There's so much new stuff going on. I mean, if you just look at the exhibit floor here, it's really it runs the gamut. But what I focus on is telehealth, AI, and kind of just the future of healthcare, which is pretty broad and doesn't help clarify much, I know.
So there's a lot going on in digital health here, but also you cover some of the interesting policy parts of it, both at the federal level and down at the state level too. So just had an election. It's still being decided.
Most of it's
pretty well decided now. Who's going to control the House, I guess, is clear. But what is that going to mean in terms of policies, investigations, cybersecurity, COVID?
So we're going to have divided government back in Washington again. No longer, I guess the race has not been officially called as the time we're taping it in the House, but the House will go Republican most likely. So we're going to see, from the House Republican side, investigations into the Biden administration. Definitely, may not be as smooth of a, it'll be tougher to get things done for both sides. Well, for Democrats. Not necessarily for Republicans, but for both sides in Congress. We'll see investigations on the House side, but I think there definitely is still some stuff that can be done because it's divided government. The parties will have to focus a bit on what they can get done on a bipartisan basis.
Jason Gurovic, the CEO of Teladoc, a completely unbiased observer of telemedicine, had suggested, which was intriguing, that the flexibility to provide more virtual and telemedicine during the pandemic would continue, and that there's bipartisan support for the rolling back of those restrictions from that used to be really hard fought by the legacy healthcare incumbents. Do you think that's true? Is there a possibility for kind of compromise and expansion of telemedicine?
Yeah, definitely. In the short term, we're going to see a temporary extension from Congress, most likely, in the lame duck, according to people I've been talking to recently.
Temporary extension of the public health emergency or just the telehealth?
Just the telehealth stuff. The public health emergency will run another 3 months because HHS didn't give notice. So it'll go through at least April. So you spoke about, you've actually written a bit about the lame duck session and what we might expect. And just to put things in perspective and what you said about Jason. So Jason, a couple of years ago, spent $18 billion on a company. Now, the lame duck session of Congress is talking about, as part of the Defense Authorization Act, $5 billion for global health. We may not get it. So you could have bought you could get 3 global healths for the price of a Libongo. I am on topic. I'm setting Ben up here. It's like, how do you think about $18 billion, right? I know for you, that's not a lot of money, John, but for most people, Walgreens, yeah, it is. So I know that's like, that's like, well, I won't say what that compares with. Yeah, $5 billion. So what is this global, health element, and why is it a defense authorization bill anyway? What's the background on that? To be honest, this isn't the area I report on the most. It was in my newsletter, but I think it's on pandemic preparedness.
I think the reality, David, is the ADA, the Defense Authorization Act, which everyone votes for. Often people attach stuff with it because they're like, well, they're not going to say no to spending on defense, and both parties have often used it as a vehicle to actually get things done where there is, as Ben suggested, some bipartisan support. I thought it was intriguing that there were a number of things that were healthcare oriented that were part of it, but apparently that's sort of the way business gets done in Washington, David, is not exactly what your civics textbook would suggest.
Hey, how about cannabis? Let's talk about the states. Okay, so if you think about healthcare, what happened with the election, there's some things that happened at the state and local level too, right? I think abortion rights, cannabis, Medicaid, all on the ballot, Ben. And I don't know if you covered those.
Yeah, so I followed the abortion stuff. And it was definitely a big motivating factor for voters. Most abortion or provision, or I guess ballot measures, expanding abortion rights access really succeeded in most states where it was on the ballot this year. And it seemed to drive a lot of people to the polls, and I think was a big reason why we saw this sort of unexpected, very moderate red ripple in the House, and Democrats were able to hold the Senate. I think was the issue of abortion was, front of mind for a lot of voters and brought a lot more people out to the polls that may not have voted otherwise.
And how about cannabis? Abortion rights, I think there
We're
was...
kind of focused on cannabis all of a sudden. Vincent, I'm concerned that our co-host is like, I may lose track of him. You were gone for a bit at lunch.
I'm not wearing sunglasses because of that, John. Okay, in case you're wondering what's going on, it's the bright lights, big city that I'm not used to. But, unlike abortion rights, okay, which I think on the ballot everywhere, there was expansion or holding back of things that were more extreme. Cannabis has maybe gotten beyond the point where it's going to succeed everywhere. And there were some places where it actually wasn't, legalization either wasn't promoted or it just wasn't, hasn't been like the issue that's like 100% a yes, like it has been in the past couple cycles.
Yeah, it's just not as hot button of an issue. And it's been legalized for a number of purposes in a lot of states. So I think we're just starting to see, we're kind of hitting the threshold. Not every state may legalize it right now in this era. But we did see some. I believe Maryland voted to legalize for recreational use starting next year. So
I'll be there next week. But
let's go.
You're still going to have to travel a little bit, David, for your... Well, let's get back on topic.
All right. So Medicaid expansion, right? So I think 39th state, South Dakota, passed Medicaid expansion. That was a state.
No, it's interesting. It's not totally shocking. People will often, buck their politicians, I think, sometimes in these states, voting for, policies that their politicians may not be, out in front and stepping for. But, if it helps them, they may vote for it, especially because it's, just a ballot measure up or down. They might not necessarily vote with, the candidate. And we've seen a lot of momentum for it.
That's got to have been a shock, Ben, that all of these red states are really going for Medicaid expansion. Is it a shock to you? You're looking at the stuff day to day.
I think everyone's just kind of grappling with how we move on, from COVID. It's very stark difference from, say, March when I was at the Vive conference in Miami, just in terms of COVID, not necessarily the masks. No one's really wearing masks here. No one really was at Vive either. But just in terms of the conversation, and it's been that way on the Hill too. COVID has really been put on the back burner. The Biden administration wants more money for COVID response. Doesn't seem like it's going to happen. They've been asking for that for a long time, and Republicans have kind of thrown cold water on it. So I think to go back to the digital health angle here. I think companies are grappling with how to handle this market also too, with reduced funding after we saw some inflated values definitely in 2021 for a lot of companies. So I think companies are trying to make do with what they got right now and try to figure out the new normal.
So we're here in Las Vegas, talking about, we can wander around the show here. There's got to be a lot of human interest stories, but there's probably some health tech stories out here as well. Do you see anything, any themes, anything shaping up?
I don't know whether you're seeing this, Ben, and I know you're seeing it, David, because my wife has started a company in the food as medicine health tech world, but the form of technology helping address or coordinate the ugly phrase social determinants of health problems and solutions, I think is really interesting because it's an area that technologists were not at all interested in 5 or 6 years ago. And now, because of, honestly, policymakers across the country are recognizing the disconnects around transportation, which we covered off with Uber, or the food deserts, or access to food, and the power that things like transportation and food and just basic housing can be for health conditions. That's one thing, Ben, that I'm seeing more of. And if you walk around the floor, although I did see one food as medicine company, not my wife Lauren's company, with an open bar at like 9 o'clock in the morning. So I'm sure it'd be really popular. I hope that's not paid for by Medicaid.
No, I think as long as you have organic mixers, then organic mixers and grain alcohol, I think, are still considered to be legitimate for
for a short period of time. But Ben, are you seeing that? Because that was the thing that jumped out when I was walking around the floor.
Yeah, no, there definitely are more companies that are trying to get in on this, and I believe the Biden administration did something on this.
Well, no, they just had I think the first time since 1972 there was a White House conference on hunger and nutrition, bringing together the private sector and the public sector and a lot of big companies, including Walgreens.
That's a medium-sized company.
To support the food insecurity. 50% of our stores are in medically underserved areas. 20% are in very, very poor areas. So for Walgreens and a number of the other large companies like Walmart and others, really believe that they've got to lean in because the healthier patients is the only way. One way to get to a healthier patient is to make sure that hungry people are fed. And I think it's that solution's got to be public and private, and in my view, not just tech enabled, but really tech reinforced.
Oh yeah, I was just going to say it's become much more of a focus in DC, at least in the last couple of months. People lobbying on it and trying to expand reimbursement in the Medicaid program, Medicaid program for food as medicine.
Ben, your observation about the lack of mask wearing is interesting. I would say, among the attendees here, there's almost nobody wearing a mask. There's a couple of exceptions. But the staff who are...
Yes, you can call me out.
Yeah. Well, you're wearing a mask, I think, because you were making bad sounds with your S's on the podcast. And so that's just meant to be like a pop filter. But for other people that are here, regular people, you actually see people that work for the convention center, for the casinos, a fair percent of them wearing masks, which is interesting because I think the sort of the elite attendees that are flying in aren't okay. Yes, such as myself, okay, and not wearing a mask, and but quite a few of the staff are, and that actually surprises me a little bit. But I think it's from a very pragmatic standpoint, right? It's not ideological at all. You're going to be exposed to thousands and thousands of people all the time, and just from a personal sort of understanding of what you need to do, that's how behaviors have shifted. I find that quite interesting. So, how about cybersecurity, Ben? That's another topic that you've written about. How much cybersecurity do we see around here, and how much is that going to be a story? Oh, John, that's what I should be.
Cyber insecurity is what you should be asking about.
Yeah, it's a mess right now in healthcare. Is something that the industry is increasingly grappling with. Companies are trying to do stuff more, and HHS and the administration is trying to do more, but there's just a lot of healthcare organizations that don't have the funds. Right now, there aren't necessarily a ton of incentives for organizations to boost their cybersecurity. So Senator Mark Warner has been kind of taking the lead on this in Congress, and he's put forward a kind of discussion document with ideas and is floating it out for comment right now. One of them is increasing or just creating incentives for healthcare organizations to bolster their cybersecurity in the Medicare program. So basically, you get paid more if you have better cybersecurity protocols.
But I would think that would make sense. I mean, the challenge right now is the incentives are so good for the external bad actor, whether it's your friends, the Revolutionary Guards in Iran, or David,
not friends, John, allies,
or just your random hacker from a country where they don't have a really great extradition treaty. The incentive mismatch is huge. I would also say, Ben, at least in our experience in looking at it, because David has actually advises companies in cybersecurity, the level of sophistication. You don't go into healthcare with a background in kind of secure tech or really tech at all. And many of the technology shops are actually outsourced to the large industrial players like Accenture and IBM. And I would argue that maybe their first focus is in the cyber protection of the hospitals and health systems. And you've got also the biggest vulnerability in any cyber situation is people. And healthcare is a people-heavy industry. I think the cards are kind of set against healthcare. But David, you should jump in here with your opinions. Normally, you aren't this shy about something you actually know something about.
Well, I'm just shy now that you called me out as a friend of the the Revolutionary Guards. Yeah, because they may be sanctioned, and I'm worried that I might come along with that. I think what happens in healthcare is that you have ransomware, which a lot of times you could stop just with basic measures. But there's so many things, on a hospital CEO's agenda that come above that. Like, can I open the emergency room? Will the nurses show up? You actually don't get to it. And so they end up being very vulnerable. I think the federal government has done actually a good job. We have a cybersecurity agency that specifically helped with hospitals, actually recovered ransom from North Korean hackers that had targeted hospitals. And so I think we'll actually see this as really part of kind of civil defense, and it won't just be the industry that's handling it. But John, I know you don't like my pivots, but I want to pivot to talk about independent journalism, because John and I are both big supporters there. probably the last two people on earth that get multiple
magazines, newspapers.
Yeah, delivered to our doors, which we aren't getting there.
It's dinosaurs that we are.
But, and there's been a record of some billionaires buying newspapers like the Washington Post. We have the recent example of Twitter, which is not a newspaper, but is a billionaire. Politico. So is it possible to go and be a professional, independent journalist these days? Do you see a bright future ahead? And how important is it to have an independent?
There's a lot of haves and have-nots. Local journalism is definitely struggling right now. And it's tough. There are just some initiatives like Report for America that's trying to get more people out into local newsrooms, but there really are a lot of news deserts right now for local news. Well, it seems like at the same time, there are a bunch of national outlets popping up, startups, where the market's already pretty saturated. So I think there are definitely a lot of have and have-nots in the industry right now.
Well, I think we'll leave it there with independent journalism before John takes me over. You're going to, you brought in Iran, I brought North Korea. We didn't mention some of the other countries, but why don't we just stop it there? But we are in Las Vegas for our third annual HLTH conference interview series. And we've been speaking today with Ben Leonard. He's a health technology reporter at Politico.
For one of the bright lights of independent journalism.
Absolutely. And along with CareTalk, I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the president of Walgreens Health. If you liked what you heard or you didn't, please subscribe. And Ben, thanks for joining us.
Thanks so much for having me.